Okay. 7:15 in Moncton. I've been in Moncton about a year. What am I doing here? You know what? I don't know. I'll find out. What's your name?
My name's Paul Moist, National President of CUPE.
National.
Oui.
Federal. Oui. Parle français?
Parle petit français.
Petit français? Parle chiac? Non, comme moi. Parle chiac. Half English, half French.
En anglais.
En anglais. That's okay. No problem. What am I doing here?
Tonight, CUPE and the Council of Canadians, Maud Barlow will be here tonight, the national chairperson. This is one of 10 town hall meetings, 10 ridings across Canada that the Conservatives narrowly won. Tonight we're in Moncton, Riverview, Dieppe, and we're talking about the Healthcare Accord. And the 10-year Healthcare Accord expired on March 31st. Former Prime Minister Paul Martin signed it with the provinces. And
what does that mean?
That is the transfer of federal money to each province to pay for part of Medicare. When Medicare came into Canada in the late 60s, early 70s, 50-50, 50 cents of every healthcare dollar came from the federal government as a transfer to the provinces and 50 cents from the province. That has been whittled down to 23 cents,
really?
77 cents the province. So Mr. Paul Martin, minority government, 2004, he gets in a room with the premiers, something the current Prime Minister will not do, and they hammer out a deal for the transfer payments for 10 years. And it restores some funding that had been cut in the 90s. Is it a perfect deal? No, but it restores health care. That deal is over March 31st this year. So 3 years ago, the Premier started asking Mr. Harper for a meeting. He doesn't want to meet with the premiers. So in December 2011, Canada's finance ministers are meeting. The late Jim Flaherty is there for Mr. Harper. He makes one proposal, take it or leave it, that's it. Here's the new 10-year deal, 2014 to 2024. What we'll talk about tonight is this deal is less than the last one. The inflation rate in healthcare is not 2 or 3% like inflation in the society. The cost of drugs, the cost of medicine, the cost of medical services, the average inflation rate in healthcare is 7 or 8%. We can't control it, the price of drugs. And the new healthcare accord we'll see in 10 years, we predict, and the provinces, most provinces agree with this. In New Brunswick, $715 million less dollars between now and 2024 than the last deal.
That's a lot of money.
Because Mr. Harper's changed the formula. So when
excuse me, where are you from?
I'm from Ottawa. Our national union's head office is in Ottawa. My home is from Winnipeg.
Winnipeg. So so is it about $750 million here? How much in Manitoba? Would you know?
About $1 billion across Canada for all 10 provinces and 3 territories. $36 billion less over the 10 years. Because we predict what inflation will be in healthcare and how this deal it caps it at 3% after they left it the same for the first 3 years, 2014, 2016, 2015, 2016, to get past the federal election in 2015. Then the inflation, the maximum increase is 3%. It doesn't matter if the cost of pharmaceutical drugs goes up 10%. It's capped at 3.
Are they forcing the province to cut down on unions and to hire non-union, less money?
To cut healthcare services, to close beds in hospitals, to close whole wings of hospitals. So there could be layoffs, but our principal concern is, will there be less healthcare, public healthcare, for the citizens of New Brunswick or the citizens of any province? So why did we pick in this riding here tonight, Moncton, Riverview?
Yeah, why?
Because the Conservatives only won this riding by 2,000 votes, about 6% more than their next opponent.
I'm surprised they won.
And across Canada, we select 10 ridings.
Okay.
We don't just have a town hall meeting, but we have this. We knock on doors for 2 weeks. We hand literature to people saying, stop the healthcare cuts. Did you know about this deal?
Of course not.
Did you know your MP has said nothing about this deal?
Yeah, of course not. I didn't know.
And our experience where we've been so far, PEI, Manitoba, and now New Brunswick, 7 more after this, our experience has been people at the doorstep say, I don't agree with that. I didn't know.
No, I didn't know.
And we're saying, well, when somebody knocks on your door next year looking for your vote, keep this. this pamphlet and send a card to the MP saying you don't agree with this. You don't agree with these cuts to
course
health care.
And Maud is a good speaker. I listened to her once for about 5 minutes. She's a good speaker.
Maud is a national treasure for Canada.
She's good.
And she has followers in every corner of Canada. And this is a cooperative effort between CUPE, the Council of Canadians, and tonight the Health Coalition of New Brunswick. So we will have a public meeting tonight, and we will encourage people to take the cards and to come and help us knock on doors.
How come people don't get involved? How come they don't?
People, I think, get it when a loved one has to be in the hospital and they're in a hallway.
They only get involved once it affects them, then they get involved.
And our parents and grandparents, they did fight to create a healthcare system. What it means is no matter where you live in Canada, you shouldn't have to be a rich person to have quality healthcare. You should all get it. All citizens, no matter how rich they are or who they are, we all get access to a doctor, we all get access to medicine, and if, God forbid, we need emergency services in the hospital, we have access to that.
What's the website?
The website for this is, you can find it at www.cupe.ca, healthcare, and we also have, I will find the website for you, I'm very sorry here. It will be on the Nova Scotia Health Coalition, or New Brunswick Health Coalition, pardon me.
That's all right.
So you'll find it there, and tonight we'll have a great meeting.
Listen, nice to meet you.
Great to meet you.
Continue.